Hello, everyone. It is with great pleasure that I formally welcome you all to a conversation with Dr. Ashwini Deshpande, hosted and moderated by Sonakshi Chaudhary. Thank you all so much for taking out the time to join us today in this interactive session. For those tuning in for the first time, Women in Econ is a nonprofit that aims to create an inclusive space for women interested in economics and policy to learn from each other, network, and collaborate. The group comprises of more than 1,900 women of various experiences, ages, and backgrounds with a common interest in economics development and policy issues. Please visit our website, www.womenineconpolicy.com, or any of our social media pages for more information and to stay updated on the group's activities. Before I go on to introduce our stellar speakers, I'd like to reiterate some housekeeping rules. As you might be notified, this session is being recorded. And so for the duration of the session, I'd request everybody to keep their mics on mute. And if time permits, we will take on the spot questions towards the end of the session, but I would encourage everybody to use the chat box feature liberally to submit their questions for the speaker. I'm very excited to introduce our speakers for today. Dr. Ashwini Deshpande is a professor of economics and the founding director of Center for Economic and Data Analysis, CEDA, at Ashoka University. Her PhD and early publications have been on the international debt crisis of the 1980s. Subsequently, she's been working on the economics of discrimination and affirmative action with a focus of caste and gender in India. She's published extensively in leading scholarly journals. She's the author of Grammar of Caste, Economic Discrimination in Contemporary India, Affirmative Action in India, and India Short Introduction series. She's the editor of several volumes and has edited the Handbook of Economics of Discrimination and Affirmative Action, published as a part of the Springer Major reference work. She's received the Exim Bank Award for Outstanding Dissertation in 1994 and the 2007 V.K. R.V. Rao Award for Indian Economists Under 45. Sonakshi Chaudhary is Manager of Strategic Partnerships and Communications at the Quantum Hub, a policy research and communications firm in New Delhi, and its sister concern, Young Leaders for Active Citizenships, WILAC. She's also a trustee of the Women of Elements Trust, which provides free legal aid to women and child victims of domestic violence. Previously, she worked as a researcher at the Observer Research Foundation and as a policy advocacy consultant with the Economic Advisors Bureau at the Union Ministry of Women and Child Development. In 2020, she completed a stint as a research and editorial lead for Women in Labor, a podcast examining India's declining female labor force participation rate. Sonakshi is a global shaper with the World Economic Forum's Global Shapers Hub, New Delhi, and has been a delegate at the 2020 edition of the Australia-India Youth Dialogue. She completed her MA in Gender Violence and Conflict from the University of Sussex as a Chevening Scholar and holds an undergraduate degree in English Literature from St. Stephen's College. Thank you both for taking out the time to participate in what I know is going to be an extremely engaging session. So without any further delays, over to you, Sonakshi.
Thank you so much, Ayushi, for the introductions and the warm welcome. And we're really looking forward to this conversation. Just reiterating what Ayushi said, please feel free to drop in as many questions as you like into the chat box. I will try as much as possible to weave those into our conversation today. And I'm super excited to be speaking to Dr. Deshpande, who's my favorite economist ever, because she always has such a unique vantage point on all things gender. So that's personally very important to me, but also on all things in general. And I know that she's just a great person to speak to about various things, particularly as young researchers working in this community, because she is, at the end of the day, a professor who's used to sort of speaking to a large group of students on a daily basis. So I'm just going to jump right in, but perhaps we can start by an overall macro picture on delivering, given what the theme of the conversation is, which is delivering data for India. I was wondering if we can just go into what a macro picture of the Indian data ecosystem looks like, particularly for young researchers. What is the one thing that you believe, Dr. Deshpande, that everyone should know?
Thank you, Sonakshi and the Women in Economic Policy team for inviting me, and also for a very generous and kind introduction. It's an absolute delight to be here today. I apologize for the postponement earlier, but I'm really glad we are doing it today. Sonakshi, coming to your question, there are two kinds, sort of two broad kinds, or let's say three broad kinds of data. One are data that are released by the government on a periodic basis, and different data sets have different frequencies of release, etc. Then there are the private data sets. So, for example, the India Human Development Survey, which is run by NCAER and the University of Maryland. Then there is a Center for Monitoring Indian Economy that runs the Consumer Pyramids Household Survey, and they all also have other data sets. This is, of course, I'm talking about survey data, which gives socioeconomic indicators. There's, of course, financial data, there's, macro aggregates, etc., which the government releases regularly. And there is also, you can call it data, you can call it information, you can call it whatever, but basically various administrative departments of the government collect, they have monthly monitoring, monitoring and evaluation information systems where different departments are supposed to upload information. Some of this is actually public, but it's not usable because it's either sitting in large amounts of PDFs or, just out there, but it's very difficult to access. And of course, as they say, data is the new oil or whatever, the fact that we are all using smartphones, we are consuming things online, we are on social media. So there is a huge number, unbelievable number of data points that get generated just as a result of our daily action. So if you look at just the total quantum of all this data, it's actually quite a lot, but most of it is not usable. For example, the private data, the private, things that get generated as we move, as we talk, as we shop, as we apply for jobs, all of that data is getting stored somewhere, but it's not usable because it's not available to the public to use. Administrative data are similar. Huge amounts of data sitting in different administrative departments, but again, not very usable. The government released data in terms of either macro aggregates like inflation or GDP or exports or imports, or the socioeconomic data that is usable to researchers, including National Crime Records Bureau, etc., etc. So there is data that's usable, but on that, one of the issues that has animated the discussion lately is the fact that many of these, the release of these data sets is infrequent or delayed, severely delayed. The biggest example, two big examples of which are, one is the Consumer Expenditure Survey, which used to be released every 5 years. And the last one that was done was in 2011 and 12. And why it matters is because our power, the proportion of Indian people below the poverty line, that proportion we get from the Consumer Expenditure Survey. So if that's not released, we really don't know how the trend is changing on poverty. And so these are all surveys. And of course, the biggest source of stock taking of the Indian people as a whole is the national census, which since 1871, we've had with regular, without delays. Every 10 years, there's been a national census. But in 2021, we did not have the census. And there is still no announcement of when we'll have it. It can't be COVID because, if you look at other government data sets, like the periodic labor force survey data, those surveys were conducted despite COVID. Other private data sets also have conducted their surveys. It can't be COVID. So this is the overall picture. Now, just if you allow me one more minute, what I will say is that various government departments have been trying to get data from different sources that the government has and trying to put it out on a common platform. So if you look at the website data.gov.in, it's meant to do that, all right? The Niti Aayog has just recently released a data portal called the National Data Analytics Portal. But the problem with all this is, again, one would expect a single data portal for all government data. right? And so now what you have is you have at least 2 data portals, and there's one more, I think, but there's no coordination between these agencies. And for the user, I don't know whether I should go to data.gov.in or should I go to NDAP, which is does a little bit better job, but it's also not that intuitive and user friendly. It's better than earlier data portals, etc. So basically, we are sort of back to square one in the sense that there are when we are looking for the data that we are looking for, like the proportion of poor in India, we don't know what it is. And then the data that there is so much and so confusing that you are bewildered and you just don't know, as a user, where do you go, where do you turn to, for some piece of information that you might be looking at. So yes, it's a large data ecosystem. In principle, there is all kinds of data that's available, but in actual fact, it's not very user-friendly. So let me stop at that, and then we can go into the details with more questions.
Of course. No, I think that's a great overview to have, particularly what you said about NDAP, because it is, I mean, like you said, one of the more user-friendly platforms that is being used. And one of the interesting things I recently watched a talk about it. They spoke about the idea of a common schema, and that's really what they're hoping to do with all of these different sort of, because otherwise you'd always see Excel sheets and PDFs, like you said, emanating out of various government departments. But the idea that you can now visualize this data, and we will come to some of the work that SIDA is doing a little bit later in the talk. But I feel like those are some very interesting areas that you've already brought up, and I think we can really delve into them in some detail. Going from what you said about the macro picture into, when we talk about specific processes, right? So every time a data set is released, I know that this is, and I'm going to come to your favorite part of this as well. We always see this increased sort of attention on certain issues. So for example, NCRB data suggests these 3 things about women's safety, not realizing that there's often a lot of caveats with this data, right? And particularly when it comes to media reporting and that sort of thing, I have noticed that there's a tendency to collapse the nuance in questioning this also. I know there's a lot of work happening around educating people about how you use data and all of that. But there is a tendency to extrapolate information from this from a social norms perspective. And I would love to talk a little bit about how we analyze information that is available to us. Like you mentioned, it's in dispersed places. It's all, different kinds of data that we're getting from different places. So what is it that needs to be done, particularly when we are thinking about analyzing some of these large scale data sets, and particularly government data sets that, are released, like you mentioned, not always with the correct frequency that we've gotten used to expecting.
Yeah, it's a complicated question. So one issue with numbers is, of course, the fine print matters a lot, right? So the devil is in the detail. And often there is not a sufficient commitment to going into the nuance or going into the detail or trying to understand how a particular number was generated. Sometimes it's also just an elementary lack of knowledge of statistics, because data analysis is there's some training that goes into it. We teach students statistics. There's something about the sample size, about a percentage, something goes up from, 20 to 21. Is that statistically significant? What that means is, if you picked any sample of the population, would you find, how many samples would you need to find where that the percentage of a particular, the incidence of something or the other went up, So is it just an artifact of that particular sample? Or if you drew repeated samples, you will still see an increase. So obviously nobody draws repeated samples, but there's a way in which you sample, or that there's a way in which you interpret increase, decrease, not changing, etc. So sometimes I find, and I get a lot of queries from journalists and students. And sometimes it's just an elementary confusion about what does a mean represent? What does a percentage represent? A percentage point increase. So when something goes up from 20 to 22, it's a 2 percentage point increase, not a 2% increase, right? Because the 2% will have to be 2% of 20. right? But people use that interchangeably, etc., etc. So some of it is just, statistical ignorance. Some of it is not willing, an unwillingness to engage with the nuance or with the detail, right? And some of it is just selective cherry picking. That also happens. So when you are looking at an analysis of data, one has to be able to, and it's not always easy. That's why there are all these, empirical debates that go on. And, at the end of the day, it's about assumptions you make, the model that you fit when you estimate, et cetera, et cetera. But I would say that to the extent possible, people should go behind the numbers and try to understand them. And I think a very good example of this is Rukmini, whose book, is a best-selling book for all the right reasons. But Rukmini has mentioned to me, and she says that in public, so I'm not revealing any confidential information, is that not that she's an expert in econometrics or statistics or anything, but she has such a keen sense of data, and she's patient. She'll try to understand. I've had conversations with her when she's written to me about some paper of mine, etc. She spends a lot of time trying to go behind the numbers and then writes her story. Not tomorrow morning I have a story and today at 9 o'clock I'm emailing you, give me quick answers, and tomorrow morning I'm going to file my story. That doesn't work, And so then there's a tendency to flatten the nuance, or there's a ready-made, tailor-made answer, And the problem with tailor-made answers is that sometimes they're right, but oftentimes it's just a word or a buzzword or a phrase, which is while it's meaningful, but it's also meaningless after a certain point, So when you look at gender gaps, now supposing you say, yeah, there are gender gaps in India because it's a patriarchal society. Correct. Of course, that's correct. But what did you understand about the gender gaps that you didn't know before? Every society in the world is patriarchal, right? And yet there's something different about Indian data compared to the American data, compared to Egyptian data, et cetera, et cetera. So just using the word patriarchy, I feel, is a shortcut that then that's the last word. I mean, what can you say after that, right? And things like that. So now, you asked me particularly about social norms. So one of the things, and so Sonakshi, you and I have talked about this before, which is that when it comes to explaining Indian women's labor force participation rates, or when it comes to explaining Indian, gender gaps in Indian indicators, a buzzwordy kind of a keywordy approach is to say, oh, it's social norms, right? Now, what are social norms? Social norms are rules, informal or formal rules of engagement whereby people interact with each other. And that includes individual interactions, that includes institutional, the way institutions are set up, that includes the legal structure, that includes, attitudes, it includes a whole lot of things. Now, which country doesn't have social norms? Societies cannot function without social norms, right? So every country has, this complex of rules of engagement, formal, informal, institutional, et cetera, these are social norms in every country, right? And so what do you explain when you say social norms? You have to go into a little bit deeper. So I was just, reading an article yesterday, I think, and it was giving intimate partner violence figures for the UK, right? And it also talked about the fact that in the first year of the pandemic, which, by the way, the UN Women said, as the pandemic spread, the shadow pandemic followed. And what was the shadow pandemic? That was the pandemic of intimate partner violence, because women were locked up with their abusers at home. And because of the lockdowns, they couldn't go anywhere. Shelters in some countries were open, but in India, that was even an issue about how to get to a shelter, et cetera, et cetera. So in the UK, roughly about 30% of women report experiencing intimate partner violence at least once. That's 1/3. This went up by 25% in the first year of the pandemic. Okay. Will you say, or would anyone say, that intimate partner violence, engaging in intimate partner violence, is a social norm in the United Kingdom? Have you heard that ever? No, you wouldn't, right? You will see that as a problem, as everybody should. And there'll be analysis. The government has talked about it, feminists have talked about it, etc. So you see that as a problem of intimate partner violence that needs solutions. And you will analyze it. You see inequality, you see that as a problem, you talk about it, you analyze it, right? But when it comes to developing countries, the whole conversation is about social norms, And yeah, I mean, discriminatory behavior, if that's a social norm, then first of all, every country has discriminatory behavior towards women in different ways. And secondly, so that's one problem with the broad use of social norms, because it ceases to explain things beyond a point. The second thing about the use of the word social norms is that it assumes that social norms don't change. That if you look at the present day developed countries, they always had the norms as they have today. And countries like India have always had the norms that we have today, right? Whatever those are. I mean, first of all, I don't even think there's anything called Indian social norms. They vary by caste, they vary by class, they vary by region, etc. So, it's a complicated thing what social norms are. Even within just women, when you look at caste differences, there are very clear differences in norms, and they also vary by. So even if we wanted to analyze social norms, I would have, one would have to do a real deep dive into understanding what norms matter and what norms need to change. So, and the curious thing about the social norms discourse is that the one norm that I feel very strongly about that needs to change is the continued prevalence of a practice which is technically illegal and is punishable, that of untouchability, right? That's a sticky norm that needs to change, but that somehow never gets invoked. But it's only in the context of women's labor force participation that the social norm argument gets put forward, without realizing how many gender norms have changed over the last 3-4 decades, including, I saw a recent paper which talks about NFHS data, which has analyzed NFHS data, and a very sticky norm, in my view, amongst the gender norms, the stickiest norm is son preference, that families want at least one son. And there's evidence to show that that of course we know that sex ratio at birth is equal, is improving. But this paper goes and demonstrates how even the sticky social norm of son preference is weakening. So gender norms are complex. Gender norms are not a monolith. Gender norms are changing. And the areas in which they are sticky, those are areas where you find pretty sticky norms elsewhere as well, right? Which is not to say that Indian women or norms in India are exactly the same as they are in the UK or in the US. Of course they are not, because every country has different social norms. Within countries, communities have different social norms. Regions have different social norms. When I go to Chennai, I may make a mistake in something because I just don't understand the cultural cues, etc., etc. And, vice versa, whatever. And so I feel like this whole norms approach, which also is the prescriptions that come out of the norms approach, are very patronizing. Like you get a community leader to tell the women, don't have more children, go out and work, etc. What the hell? We know, I don't need a community leader to come and tell me what I should or should not do, So on the one hand, we talk about freedom of expression, freedom of mobility, freedom of this, autonomy, etc., etc. But then the norms approach will say, some community leader, some religious leader must play a role and, tell women, so it's, I find many, many troubling aspects about the prescriptions that come out of norms. Norms change when material conditions. That's the final point I'll make about norms, is that what's the dog and what's the tail? Which is the horse and which is the cart, right? Do people have a change of heart and then norms change and then conditions change? Or do conditions change, that material conditions change, that lead to changes in social norms? So when you look at labor force participation rate, the topic that we talked about the last time we met, if you look at Europe, for example, it was the First World War and the influenza epidemic that was a big boost to sending women into the paid workforce. Before that, the social norm was not of women working outside the home, right? But the high mortality that was caused due to the First World War and the influenza epidemic sort of force women into the workplace. And then things started to change. It reflected in the clothes women wear today compared to 100 years ago. It reflects in the distribution of domestic work or the frequency of domestic work. Meals are quicker, shorter, fewer, etc., etc. There are all kinds of things. And it's only when women stepped out of the house, then the norms changed, not the other way around. It's not like everything changed and then casually women sauntered out. No, that's not the way it happened. So even if you want to use the norms perspective, then I would say get into history, look at how norms changed over the years, and look at what norms have not changed. I have a graph from our World in Data, which all of you can also generate. When you look at proportion of the hours spent by men and women on domestic work in the US, and that's a 100-year graph. So you see the proportion, the time spent by men increasing rapidly, time spent by women decreasing, but it doesn't touch. And from the 1980s, that gap has remained constant. And people say during COVID, it has increased. That I don't know. I haven't seen the latest data. But basically, it stopped converging after 1980. So even this norm in the US setting, yes, there's been a huge improvement, but it's still sticky. So I think, okay, if you want to talk the language of norms, let's do it. But then let's do it for all societies. And let's look at what sticks, what changes, what are the factors that lead to norm changes, etc. I would welcome that conversation. So there's nothing, it's not like, oh, I don't want Indian norms to be discussed. Not like that at all. Let's discuss all societies' norms. But if you're using economic explanations for other countries, and I suggest we use economic explanations for India as well. Why is it that you don't see enough women in the paid workforce? Is there a problem of demand for labor? Is there a problem of precarity for women's labor? Are machines, technological change, is that replacing female labor more than male labor? Are employers biased against women? Are workspaces not female friendly, right? Is this all social norms? Okay, fine. Then every country, then we just need one word to explain any gender gap, right? But so I think that maybe this is a longer answer than what you were hoping for, but I just feel like either we use the same terms for all countries, or we accept that in India, especially when we are looking at women's participation in paid work, we have to then examine all kinds of factors that shape that participation.
Absolutely. In fact, even as you were saying it, the first visions in my head were of dishwashers and washing machines, because God knows they did more to change social norms and actual attitude shifts. And that ties into my next question to you, which was about, and you've answered some of that already in some of your remarks, but specifically when we're collecting data on attitudes or even analyzing data on attitudes. For example, the NFHS has a lot of those questions that do examine what people's attitudes are towards various issues. Now, I naturally gravitate to that section that talks about attitudes towards intimate partner violence and all of that, but there is a vast variety of information that does come out of NFHS. So when we're probing numbers like those, for example, is there something we should be doing? And should we be doing something different when we're looking at those sorts of numbers? How is it that we should think about using numbers that come from these large-scale data sets that are conducted, every couple of years?
So domestic violence or intimate partner violence data is always a little difficult to interpret. And I'll tell you the reasons for it. So when you ask a woman, did you experience XYZ form of violence, in the last 12 months, she can say no for two reasons. Or supposing she says yes, okay. Now, obviously it means that she did experience that, right? But if she said no, it doesn't mean that she did not experience it. It could be that you don't want to acknowledge it. It could be that you know it, but you don't want to say it to the public. It could be that somebody else was in the room when this question was asked. It could be that she fears violence as a result of the fact that somebody came into her house and asked this question, right? So yes means yes, but no doesn't mean no actually in this case, right? So when you see an increase in yeses, is it that women are now bolder and reporting more? Or is it that violence actually has gone up? And you cannot answer this question with any degree of certainty. You just cannot, right? So that's one thing to be very careful about. The second thing is that when you, even in that, by the way, NFHS, many of the other mobility, not so much violence, but if you look at the mobility questions, autonomy questions, decision-making questions, a lot of those attitudes have shifted for the better, by the way. So if you look at the last 3 NFHS rounds and you compare these attitudes, they have improved in India, so they're nowhere far from being perfect, but they've improved. So just to note. Back to the question of domestic violence or intimate partner violence, everywhere in the world, there's a tendency to underreport. Because, it also makes women feel, that's the whole purpose of domestic violence, which is that it gives the perpetrators power over the victim, right? And so because the victim feels helpless and powerless, to even admit that you were a victim of this kind of violence it's not easy, it's not pleasant. Often women work in compartmentalized, silos, otherwise you won't be able to live your life. So you go to work and you try to forget that, you're going to go home and you might be subjected to violence and things like that. So there are all kinds of accounts. And so researching domestic violence is one of the most difficult, or intimate partner violence for that matter, is one of the most difficult areas of research, and not just in India, everywhere, right? And because it can have actual negative consequences on the respondents' physical or mental well-being immediately after the survey. There is also a bit of a debate about whether it's even ethical to ask women directly about their experiences, because there could be backlash from the family. Why did you talk to a stranger and, tell them, etc., etc. So there are all these issues. Anyway, there is a data set that those numbers are there. But I think when we examine those, we can look at perhaps, differences across different segments of women, but with the caveat that an increase in the proportion of yeses could just be the earlier no's who were actually yeses, but now they feel bolder and say that it's a yes versus not. That's one thing. So therefore, often people look at the actual crime records bureau data, which is, FIRs being filed. But again, there is an underestimate there, because a lot of women will not go to the police every single time they're beaten, right? Emotional violence, who goes to the police for emotional violence? It's very rare. So even NCRB figures on domestic violence are huge underestimates, because even to get out of the house to go to the police station, I mean, it's not easy at all, and so why don't women just leave abusive marriages? Well, that's a question that is one of the most difficult questions to answer, not just in India, everywhere in the world. You look at the literature on intimate partner violence, it's horrifying, the experiences of women, their inability to leave those abusive relationships, the power, the hold that the abusers have over them, etc., etc. So I would say, whatever analysis you do with that data, be very, very careful, be very tentative, put in a lot of caveats. The data is out there, so you can analyze it, obviously. But, I would just tread with utmost caution. And because these are figures that tend to get sensationalized, I would be super careful about how I would analyze them.
Yeah, in fact, to add to that, even like you said, the caveats that exist even with an NCRB, which tells you very clearly upfront that it only categorizes principal crime offenses, which means that the highest kind of crime. So I could have reported under 4 sections of IPC, but it will only be the crime that is considered a principal offense that it will be marked under, which is where the reporting gets a little bit skewed. And typically the tendency when reporting, and this is an example, I mean, I know we've gone into the domestic violence example in some detail and IPV, but even otherwise for other sorts of attitudes, like you mentioned, on mobility, on autonomy, there is a lot of information out there. So it is about, like you said, caveating a lot of that information, even when we are looking to analyze it. I think this actually brings me to, it's a great segue into my next question as well, which was particularly about these large-scale data sets on a more principal level, right? So for an example, an NSS, the labor force work that's happening, the NFHS. And this is another thing that we don't talk about enough. when we caveat it is what exactly the sample sizes for something like this look like. So how nationally representative some of these large scale data sets are, and are they giving us a clear picture of what's actually going on the ground in the absence of, like you said, census data this year, or well, 2 years ago now. But what is it that these do for us, and how much should we be relying on these sorts of data sets in the absence of, the macro one?
No, they are fine. I mean, they are very representative, and that's not an issue. Whether it's NFHS, whether it's NSS, PLFS, whether it is IHDS at the national level. So some are representative at the national level, some are at the state level, some could be at the district level as well. So that depends. You have to caveat. And obviously, because these are survey data, they don't exactly, and often the question asked is not the same. So the whole point about survey data is the answer is very sensitive to the question that is asked, right? And so I always tell students that you must read the questionnaire, actually, just literally the wording of the question, to see what answers there are. So they are representative. That's not a problem at all. The actual estimates will vary because the survey methodology is different a little bit, the sampling is different, the actual question might also be different. And so it depends on which indicator you're comparing. And so you have to, again, all this comes, some degree of either formal training in an institution or self-training. Not that it can't be learned, but it would be good for everyone working with data to invest a little bit in self-training, if not, if you haven't studied statistics, or if not been through a formal institutional course, it's a good idea. It's a good investment because you can use it. You can, if you're going to be working with data, you might as well, learn a little bit about how it's generated. So paying attention to the fine, a lot of it is very, very technical. So that's fine. You don't have to do that, but at least some basics. So I don't think that the problem is with the fact that data are not representative. That's not the problem. So that, that's my view. Just one more thing linked to the earlier question on mobility, etc., and how that's linked to social norms. I'll just say one thing. When people, I've seen many, including students, when they analyze the autonomy and mobility and decision-making questions in NFHS, right? So for every question, as you know, Sonakshi, there are many options. Do you do this on your own? Do you do it with your husband? Do you, etc., right? And many people will say that if the woman doesn't do it on her own, so doing it on her own means she's autonomous or empowered, and anything else is not empowered. So it's a 0-1, right? Now, here I would say bring in social norms. So for example, I'm perfectly capable of going to a restaurant on my own or going to a movie on my own. Obviously, you know that. Yet somehow in India, I never go for a movie on my own because I just feel like it's a social activity. And if there's nobody to go with me, I won't go, Whereas when I'm in the West, somehow it seems very different. I'm going for an English movie or whatever. I'm happy to go to a movie or happy to go to a restaurant and just, sit with a glass of wine or whatever by myself. Whereas in India, I never go to a restaurant on my own. I know it's not I'm not saying it, that's the way it should be, but it's just a different setting. These were frivolous examples, but the most serious one, for example, the healthcare system. In India, if you had to go to a hospital for even an OPD appointment, and certainly for admission to a hospital for any procedure, it is impossible for a single person to do it on their own, male or female. You have to get admitted. Then you have to, dawai leke aao, ye hai, wo hai, get the medicines. Then suddenly last minute they'll say, oh, but these falana tests have to be done. Then somebody is running pillar to post, etc. Sometimes even having one person is not enough because there's so much reliance on external helpers. Whereas if you were in the US or in the UK, the whole hospital admission system doesn't assume that there will be somebody with the patient. So it's all geared towards a single person who's the patient to just do it by themselves. There'll be lockers to keep your valuables, etc., etc. So you don't, because the system there is different. Whereas in India, if you were to go get admitted to a hospital, it's impossible to do it on your own. So even if you were willing to go alone, you would not. I mean, you can't. You need somebody, right? So either for reasons of, you think of leisure time as a social time also. So leisure is socialized. Leisure things we usually don't do alone, right? Because that's, for women particularly, that's part of the fun of leisure. You get out of the whole house, you get out of, you don't want to be alone. You want to be with friends or, some cousins or something like that. So you're looking forward to that escape from home. And or there are institutional barriers in accessing services where you need somebody with you. That's just the reality. So there, when you analyze questions, I always say analyze woman alone and woman with partner as one, and then everything else as the other, right? Major decisions, I, again, giving my own example, I've taken financial decisions. I've, property, jewelry, travel, consumer durables, obviously, but I've never taken any of these decisions without consulting my family. Does that make me any less empowered? I don't think so. I just feel like it's a huge amount of money that's going to be spent on something. And I just want to make sure that, I'm doing the right thing. And then everybody, particularly if it's a consumer durable, I want to make sure that the whole family is involved in that decision. I'm not being coerced, but I just feel like some of the answers to say only if the woman does it alone, is it empowerment, and everything else is lack of empowerment. I think the real question that should be there is, if you wanted to go alone, could you go or not? That's the question that's missing. The question is, do you go alone? And so if you ask me that question, a lot of the times I'll say no, And so I always tell my students that whatever questionnaire you make, apply to yourself first. Try to answer those questions for yourself and interpret those. Then suddenly the penny will drop. And you will realize, oh, okay, fine. This doesn't apply to me and I am empowered. So what does that mean, And then you will realize that empowerment is not 0 or 1. It's a process. So we are empowered in certain dimensions, not very empowered in other directions, or whatever. I mean, it's a matrix. It's not a 0, 1. Like yesterday I was not empowered, today I'm all empowered. It's not like that. So I think that, again, back to the nuance story. But here I would put in social context much more in analyzing these questions. And so anyway, coming back to the data sets, it's totally okay to use the big survey data. They're all fine. I mean, they have their own assumptions, as I said, but they're okay. Of course, capturing women's work. Not all of them do a good job capturing women's work. So that conversation we should have. What are the questions that get asked? For example, when you look at the IHTS, there is no decline in female labor force participation rate because they do a much better job at counting women's unpaid economic work towards family enterprises. And because they count it, that data set doesn't show a decline. Between 2004, 5 and 11, 12, there's no decline according to IHTS, right? So here's where then the question of definition, the question of measurement becomes important. But I mean, my point is, if you are interested in these issues, you have to take the trouble to engage with the nuance.
Yeah, and also look at time use survey data. I feel like that's a big one that often gets skipped. And,
Absolutely.
2019 was such an interesting exercise, just reading through some of those answers, particularly since you brought up the subject of women's economic empowerment. At least for me, at the time we were, and this is a bit of a segue, but at YLAC, we run a lot of programs. So we were doing young researchers for social impact. And interestingly, it's a group of, say, 15 to 16-year-olds. They'll be writing on a topic, and they were looking at FLFS. I was mentoring this team that was had that as a topic, and they went straight for the time use data. And these 16-year-olds are producing this amazing piece of research at the end of it, where they've actually gone into these ideas about, what is women's work and what is even counted and stuff like that. So I think that there's a lot of scope for a lot of interesting activity from reading those sorts of data sets as well. I think now I'll move into the last part of, the last segment of questions that I want to ask you, which is around solutions. And this is perhaps where you can weigh in a little bit more on what CEDA has been doing. Particularly when we talk about the role of institutions in making these findings more accessible for stakeholders and laypersons. In your opinion, what needs to be done? And perhaps you can talk a little bit about the work that's already happening in this space.
Yeah. So, going back to the first question that you asked and my answer, the data ecosystem is a little bewildering and confusing, and it's too much and too little at the same time. You know what I mean? There's too much floating in the air, but there's very little that you can make use of. So at CEDA, what we do, CEDA is Center for Economic Data and Analysis, which is at Ashoka University. You can visit our website. It's ceda.ashoka.edu.in and check out our website. So basically what we are doing at CEDA is trying to make summary statistics from publicly available data sets freely usable and customizable to any member of the public. This could be a journalist, a student, anyone, right? And so what you can do is you can put in your query and generate a visualization, which could be a heat map, it could be a line graph, it could be a bar chart, we give different options. And what are the data sets that we have there? These data sets are publicly available. So if you had the training, you could download the unit level data and generate these numbers. But a lot of us don't have that training and not the time either, to do this. So what we do is we calculate averages and percentages of important variables from the labor force statistics. So that's the National Sample Survey, Employment Unemployment Survey data of 2011-12. And then the PLFS, the Periodic Labor Force Survey data that's coming out, has been coming out since 1780. So that's that. Then we have the National Family Health Survey, NFHS, all 5 rounds, key variables we've summarized. We have the Annual Survey of Industries data, which is about registered factories. So again, a small segment of the workforce, but an important segment of the workforce. We have the National Crime Records Bureau, the NCRB data, which is based upon police FIRs, etc. Not just crimes against women, all kinds of crimes. That's as far as the survey data is concerned. Then we have, what we do is we have scrapers running on data that get released by the government. And I'll talk about we have 3 such tools. So one is called an agricultural markets. So agricultural commodities get traded in mandis every day. And this goes from, livestock, cows, buffaloes to, grain, rice, etc. All this. And so what we do is we scrape the daily quantity and price data from every single agricultural mandi in India, but we release it at a monthly level because sometimes the updating of the websites takes time, etc. So you might see 0 transaction on a day just because the data didn't get uploaded. So we release that at the monthly level. And you can go into our tool and you can literally see the price, the quantity of commodities across states, across time. I mean, there's a bunch of different options that you can give. It's a query-based visualization tool. So that's one. The other is food prices. So the Department of Consumer Affairs, for 179 locations in India, it releases daily retail and wholesale prices for 22 commodities. Again, these are scraped on a daily basis and they are in our tool. So that's, if you wanted to track inflation in real time, you can, go to the CEDA website and do that. And then we have what is called an ecometer, CEDA ecometer, which tracks just macroeconomic aggregates, including, Google mobility, et cetera, just giving a snapshot view of the economy. So this is what we already have. And then we're adding more data sets. So there's a data part. And then we have what are called data narratives, or picture this, so the little graph and some information. Why? Because as I said earlier, you see a number, you see a bunch of numbers, and it's not everybody who can make sense of what those numbers mean, or how do you understand these numbers. So interpreting numbers is not as easy as it might appear at first glance. So if you're getting into the data space, I would say be prepared to A, get your hands dirty, B, dig deep, and C, be prepared to focus on nuance. And our data narratives show you how to do that. So we are very non-rhetorical, there are no polemical arguments, etc., no jargon. And we just look at the data and tell you, okay, this went up, this went down, etc. So we just analyze the trends in data and try to demystify data. try to bring it closer to a person who's interested in the data. So that's what we do at CEDA, and I think that's what we need going forward in the data analysis space, which is to, how do you make sense of all these numbers? What does all this mean, and how do you understand it? And there, I think we need to be open. So if there's a trend that has improved, so what happens is today the data space is very polarized. So either you are in favor of the government, which means nothing could go wrong, or you're completely against the government, which means nothing could go right. Right? And I don't think either of those approaches, because socioeconomic trends are not driven by just one particular government in power at one point or another. So the fact that India's total fertility rate has now fallen to 2.1, that's Indian society developing in a particular way. It's not due to this or that government. And so it's totally all right to acknowledge that and to say that it's a very positive development. So that's what we do at CEDA, which is we look at what the numbers are showing us and we'll say it like it is, And so I think we need to take the jargon out. We need to take buzzwords out of the conversation a little bit and pay more attention to what the data is saying, and, and be prepared to accept all possible changes, good, bad, no change, anything can happen. And I think we should be prepared to look at that.
I think that's a really profound note to sort of capture all of the things that we've discussed through this conversation. I'm going to pause here and ask the WIEP team about a time check. So how long do I have before you want?
Another 5 to 7 minutes. We're okay also extending it by an additional 5 minutes if required, but yeah.
Got it. So I'm not going to do too many follow-ups at this point, so that just in case people do have questions, I'm happy to sort of at this point weave those in. If you'd like to unmute yourself and speak, you can raise your hand and I can sort of call to you if that's something anyone wants to do. But otherwise, I will go into my last question about this. Yes, Riddhi.
Good evening, ma'am. Pleasure talking to you and listening to you as well. Actually, I am working in policy space, and I'm looking at data that is available on persons with disability on various indicators such as education, health, employment. But at times, a data point which is said to be there in a questionnaire, but is not being actually reported when we look into the data source. So we are doing a very in-depth study. So we are not just looking at reports, but we go through the questionnaire and then we go back to the data and see if that data is there. But at times we don't find that data reported, or there are a lot of zeros in the column of that variable. So how do we comment on this? Can we criticize or say that it's a gap that the data is not being reported? How do we present it to the public so that it does not sound like we are criticizing, but also we are making a valid point? So that's a dilemma that is going on a daily basis. So it would be helpful if you can guide us.
No, you must say if there's a data gap. I didn't say don't criticize. I just said comment on whatever you're seeing. So yeah, you're absolutely right. There's a lot of missing data, lots of zeros,
right.
And that's undercounting. So we don't really know the full extent of the range of disabilities that Indian population suffers, Again, the census should have been done, that should strengthen. So there are lots of gaps in the Indian data ecosystem for sure, and not having good quality data on disability is one of the areas. And what that does is that it hampers correct policy making, because policies should be based upon a good analysis of data, for policies to be correct. And if you don't collect data of a certain kind, policies will never get made in that direction. This is an excellent book which I recently recommended in the newsletter that we bring out called Women in Work. It's called Invisible Women. And it talks about, it's not about India, although there are examples from India. It talks about how women are invisible in data, So for example, take something like medical trials. It's only recently that when you do medical trials of medicines, women are also subjects, So earlier, all the efficacy of medical, medicines that you got, the data on that was all run on men, and women's bodies are different. Their medical, the way they react to a particular medication, et cetera, all that is different. And that you didn't have that. Now it's changing as a result of the fact that people talked about invisible women or absent women in the medical research data, et cetera. And there are many other dimensions. So for example, one of the examples that book gives is about city planning, bus routes. So the bus routes that run in the off-peak hours are the ones that often women who work at, are not going to office use because they get out of the house to go for vegetables or, dropping children or whatever, picking up stuff. And the off-peak hours are ones that are so complicated. So a short journey actually ends up taking much more time for women than it is for men. So there are many, many ways in which you need data use. This whole question of Delhi government making bus rides free. I get asked about this by journalists all the time, but where's the data? We know that the Delhi government did this. That we know, But what do we know about ridership of buses before this move was done? The gender breakup of the ridership. And what do we know about the gender breakup of the ridership today? Just quoting the ridership today doesn't prove anything. Because how do you know it's the before and after, So you need to, unless you have a data on a continuous basis, you would not be able to say whether the introduction of free tickets increase women's ridership in buses. We can't say that. I don't know. And so I always refuse journalists, and they get very upset saying, oh, but how could you not comment on that? I said, because I don't know the ridership data before. So how can I comment on that, So things like that. So there are many dimensions in which data are missing, and you're absolutely right to notice all those zeros. But you should say it's a big data gap. You must absolutely say it.
Yes, we will do that. Thank you so much.
Actually, that covers exactly what I was going to ask also in my last question to you, which was going to be about data and policy making. But I think you've already captured that very wonderfully with an example. Are there any other questions before we sort of close this out? Okay, great. Thank you so much, WIP. I will sort of ask Ayushi to close out the call.
Thank you so much, Professor Deshpande and Sonakshi, for really taking out the time, not once, but twice now, to engage with our community. And this was such an insightful session. I was nodding along the entire time. So thank you again for taking out the time and for engaging with our community. And to everybody else, thank you for being such a wonderful audience. We do have more such events happening every now and then. So do keep an eye out on all our social media platform pages. But yeah, I think we're good to close the session. Thank you all so much and have a great week ahead.
Thank you, WIEP. Thank you, Sonakshi. Thank you to the audience. Thank you for tuning in.
Yeah, thank you.
Bye.